Dr. Koplin, we've talked about the full facelift. Your specialty with the facelift is fat grafting, adding fat to those deep lines in the face.
Yes.
Tell me about that.
Fat grafting is the most powerful key to a facelift, in my opinion. It is simply taking fat from some part of the body and placing it into the face, particularly in these deep nasolabial folds, the lines here around the mouth and the chin. It's the part of the surgery that makes everything else work.
And is it neglected?
It's
Oftentimes.
neglected because I see patients come into my office, they've had a great facelift by a great surgeon, and they're bitterly unhappy because they wanted this fixed first and foremost.
Those deep lines
fails.
right here.
Yes.
Some people say that you're the king of fat grafting, adding volume to the face. What's your response to that?
Well, I don't like to use words like king, but let's just say that I have the longest experience and the most experience in doing this. I've been doing it about 10 to 15 years and getting better and always improving and working on my technique. I'm very comfortable and very happy and very proud of my results.
Where else are you adding fat to the face, by the way? Under the eyes?
Yes.
What about those chin lines?
Under the eyes, into the hollows of the cheek is a very common area. Sometimes under the tail of the brow to bring the brow up rather than having to pull it with a brow lift. In the lips, there's nothing better than a lip augmentation or a lip enlargement with fat. Anything else you put in the lip comes from a dead cow, a dead person, a lab, a piece of Gore-Tex, which is what my tent is made out of. There is nothing more natural and appropriate and beautiful and permanent than putting fat in the lips. It looks beautiful.
We really are out of time. What should somebody look for then in a surgeon that's going to do any one of these procedures we talked about? What should they ask them? And how important is experience and frequency and all of those things?
Experience and frequency and talent and having done a lot of the surgeries that you specifically are interested in is the most important thing. Someone can do something wrong 1,000 times, however, and still do it wrong the next time they do it. So the surgeon has to be well trained so that they know how to do the surgery properly. They have to be observant and artistic to see what is going to be the right technique for that specific person.
So what do you tell the person watching this? Look at the surgeon's results, check them out? What do you say?
Make sure they're a real board-certified plastic surgeon. Make sure they've been out on the highway a little bit. You don't want someone who's been doing it around the block. You want someone that's been on the freeway doing big surgeries on big people with important and good results. And you want someone that you also can get along with. You need to have some rapport with the person because not everything turns out perfectly. And you need to be able to talk to the surgeon, to be comfortable telling them what your wishes and what your disappointments are to make sure that everything is right. I mean, my job is not to do a perfect result. My job is to have a happy patient that feels they got more than their money's worth and was treated properly.
I have to ask you this question about how much younger can you make somebody look? What do they say? 10 years?
People ask me that all the time. I tell people you're going to look somewhere between 10 and 20 years younger, like you used to look.
Can you do that, though? Somebody 60, they could look mid-40s?
Absolutely.
I mean, do you hear that?
Absolutely. The key is to make them look like they used to look. And again, it's not just pulling the skin. In fact, that's the least important thing. It's putting the deep tissues where they belong and softening around the mouth with the baby fat, keeping the lips, attention to the lips, attention to the smile. People can look beautiful. But now, let me give you an analogy.
Okay.
Someone says, how long does it last? The real answer, and I don't mean to be a smart aleck, the real answer is it lasts forever. It's not like Cinderella that at midnight they go poof and it wears off and they look as if they'd never done it. If you look 15 years younger, you will always look 15 years younger, which is why I say it's the gift that keeps on giving. You will always look better than someone, say your identical twin, who's never done the surgery. It's a wonderful, permanent improvement.
And you do all your own consults. I mean, if they go and see you, they're seeing you.
I see every person myself. I see them twice, actually, beforehand. And then I talk to them before, and I tell them I put in every stitch. I put the bandage on at the end of the operation. Every single part of the operation, I'm always in the room, and I do everything myself.
Dr. Koplin, I want to thank you for coming on the show. Very interesting.
Thank you. It's my pleasure.
You've been watching The Wellness Hour. I'm Randy Alvarez. If you would like information about future airings of this program or other show topics, visit our website at wellnesshour.com. For now, I wish you good health.